You are listening to Wealth Talks, where we talk about solutions, money, and other things that create wealth in your life. Imagine for a moment that you go into the hospital for some routine test, and you end up staying there for weeks. In fact, you stay there for so long that your hospitalization bill comes to well over a couple of $1,000,000. You might be saying to yourself, well, that's not really feasible. But when you think that the average hospital stay today is $10,000, and that doesn't include special equipment that might have to be used, like dialysis or heart equipment or monitors, that's just the bed. So all the doctors, all the respiratory therapists, all the specialists that come into your room, every nurse that pops in, that's on top of that $10,000 average stay. This is what we're facing today in America, and that is why healthcare has become something that can destroy your wealth very, very rapidly. And we have seen that happen personally to individuals in our family, and we have wanted to step into this arena and try to help you figure out what you can do to protect yourself.
That's right. So a couple of weeks ago, we did a podcast with Jack Cooper of Take Command Health out of Texas, and they help people to find the best health insurance by shopping across several different carriers using an online comparison system. So if you're in the states of California, Texas, Florida, Georgia, Tennessee, Wisconsin, Michigan, Arizona, Indiana, North Carolina, or Pennsylvania, they have some great resources online that can help you. And I'll include a resource link where you can look up more information about getting health insurance in those particular states. So they have a great system for helping with that.
You do have options in those states, huge options, and Jack Cooper can help you on that. So we really encourage you to go and look at that and compare and shop, because there isn't a one-size-fits-all in healthcare today, and you need to be prepared so that your wealth isn't destroyed by some little health incident that could happen. You know, recently, my brother-in-law, who is in his 40s, just woke up one night with a heart attack. That could have devastated their family had they not had the proper insurance in place. You don't want something like that to happen to you. And of course, with the healthcare laws being so volatile right now, it's really hard to know what to do. And Jack Cooper can help you.
Yeah, and so that's on the insurance side. There's also something for people that are facing rising insurance premiums and not really seeing the coverage that they want in the traditional insurance anymore. And that seems to be happening more and more. People are turning to alternatives to traditional health insurance, things such as healthcare sharing ministries. So today we wanted to devote some time to that. We'd sent out an email a while back about the Health Insurance Podcast. Several of you responded with the different information about the different healthcare sharing ministries that you're using. So we want to give a special thank you, a shout out to Kurt, Dr. Kurt, Dr. Donald, Amy, Catherine, Rob, Dr. Miguel, Valerie, Greg, Sean and Julie, Eric and Lisa, and Jonathan. Thank you for responding on that and providing some of the input for today's podcast. We want to talk some about the healthcare sharing ministries. Some of the primary differences between a healthcare sharing ministry versus traditional insurance. It's not traditional insurance, for one. The payments, the reimbursements are not guaranteed. But you look back at the track record, some of these ministries have been sharing members' healthcare expenses going back for several years now. They have a good track record with doing that.
And the nice thing about it is, even though it's not considered traditional insurance, it does fulfill the requirements under the Affordable Health Care Act that was passed under the Obama administration. So if you're sharing in one of these ministries, you have fulfilled your obligations as far as the insurance portion and won't be fined by the IRS.
Yeah, so there's several different options to choose. Most of them are Christian-related groups that are running these healthcare sharing ministries. Some overall things to be aware of when looking at a healthcare sharing ministry, comparing it to traditional insurance. Pre-existing conditions aren't always going to be completely covered. You might have higher rates based on your health status. Overall, the rates are usually lower. The sharing amounts are usually lower than what insurance premiums would be. You might not have all the, quote, essential health benefits, which you may not use anyway. Things such as mental health, substance use disorders, they might not cover things like that. Some prescription drugs not covered, things like that. There might be certain limits on healthcare sharing plans that they won't share up, or they'll only share up to a certain amount. And with a healthcare sharing plan, you usually cannot use those in conjunction with an HSA account. Those are some things to be aware of, generally speaking.
Now, if you have an HSA account that you had with a previous employer or healthcare plan, those funds don't disappear. You can still use them as you graduate into a healthcare ministry sharing plan like we're talking about. Those funds just don't automatically disappear when you make that switch. So it's important for you to look and shop and compare these different ministries to your current insurance coverage to see if, number one, it can't save you money, because you might need all the whistles and bells that are on the policy that you're paying for right now. With the fact that pre-existing conditions cannot be excluded, that raised the price of insurance tremendously across the board. And so it's not unusual for people to be paying over $1,000 a month for a family package now. And you can get something much more cost-effective for you with one of these ministries, but it might exclude a pre-existing condition that you have.
Yeah, good to be aware of. So we wanted to run a comparison real quick. There's three big ones in the healthcare sharing field. There's Medishare, Christian Care Ministries. That's the organization that runs Medishare. You have Samaritan Ministries. You have Christian Healthcare Ministries, which is different than the first one we mentioned, CHM. And there's also Liberty Health Share. So those are the four ones. The first three are the big ones that we want to talk about a little bit today and compare a little bit. About a year ago, our family switched over to Medishare, and our premiums probably went down by at least half.
At least
of what they
yes.
were on a group plan that we were on that was sponsored before. So it definitely saved us money on the premium side. Looking at some of the pros and cons of these different options, here are some of the reasons that we chose to go with Medishare. Number one, and probably the biggest thing, was that there's no caps on the sharing amount. There's no annual cap, there's no per incident cap, no per person cap, or no per lifetime sharing cap.
And that's really important because, like we just mentioned in the story to start with, that was a family friend. And those kind of medical expenses would pretty much wipe out anybody in the United States today, unless you're a Bill Gates or a Jeff Bezos. So we need to be really careful that we have no caps on the coverage that we're getting.
Yeah, and so one of the only reason we really had insurance anyway is to take care of the really big stuff. Otherwise, we're mostly just paying out of our pocket for it.
Yes.
And we were fine with that. So that's a pro for Medishare. With Medishare, you also get free 24/7 access to virtual providers online through MD Live, which is often a perk that only comes with big companies or big companies sponsoring a healthcare plan that you're on.
And that can be really beneficial for you if you have a lot of medical concerns and you're not really well-versed in the medical profession and don't understand a lot of it. To have access to someone virtually like that is trained and skilled, can answer your questions of whether this is something that you need to go see a physician about or whether it's something you can take care of at home. So that's a good option.
Yes, that's right. They also will negotiate bills for you. So you send the doctor bills to them. They'll take care of the negotiation for you.
Oh,
that
God.
helps a lot.
And that is so important because, it's been stated that over 50% of all hospitalization bills and doctor bills have overcharges in them that shouldn't be there. And I can attest to that. just with my own mother having been in the hospital a year ago and seeing the just exorbitant fees that were charged for things that maybe or maybe not were even done. So there is always room for negotiation, and it's important to have someone that understands the codes that those bills are written in, which I was able to do because of my past training in the healthcare profession. But many people, it's like a foreign language. So this service is just tremendous.
Yes. Now, Medishare does have caps on certain specific things. So like pre-existing conditions, like we talked about, generally speaking, they might not cover everything there. If you're in a motorcycle wreck, there is a cap on what they'll pay there, $100,000 up to $100,000.
And you can see that.
Things like that. Yeah, it makes sense. Reading through their guidelines, they're very simple and easy to understand, especially when I compared, when I was reading all the guidelines on all these different four healthcare sharing ministries. I would say Medishares were the easiest and the most simply laid out. So that's
something that really attracted me to Medishare too, John, is, I'm 58, and it's not going to be too long before I'm forced to take that horrible federal subsidized Medicare, whether I want it or not. But Medishare has a senior assist program that extends Medicare.
Yeah, so Dr. Don wrote in, he says, we use Samaritan Ministries the past couple of years. We like the idea of sending money directly to those in need. However, I'm thinking about dropping it because of the expense. He's 64, 65 now. So he says, for years we carried on catastrophic coverage, but then that became too expensive. He said, now I'm covered by Medicare Part A, but I haven't signed up for Part B. I'll turn 68 in December, so I know I will be penalized if and when I do. So that's Samaritan Ministries. The price is going up on him. That's something to keep in mind. Medishare has a senior assist plan, like you mentioned. If you have Medicare Part A and Part B, then they will kind of extend that coverage. So anything that is approved by Medicare but not actually covered, then they would pay for that, and it's pretty reasonable price per month.
And while we're talking about that, it might be important for you to realize that Medicare Part A and Part B, Medicare Part A pays for hospitalization according to the rules set up by Medicare. So if a broken hip is a 10-day stay in the hospital, in 10 days you're going to be kicked out of the hospital whether you can stay or not. They're going to put you in skilled nursing. And Medicare Part A may pay for that, and it may not, depending on why you're discharged from the hospital and how it was written up. Medicare Part B pays for doctor visits. And so that's important to realize that some of the doctor visits you may have while you're in the hospital may not be covered by Medicare.
Part A.
Part A.
Yeah. So that would fall under Part B then.
That's part. And then, of course, there's Medicare Part D that pays for prescription items and things like that. But it's important for you to realize what these are if you're approaching the senior years where you're going to be forced to make a decision of what you're going to purchase. Now, with my own mother, she decided years ago to only take Part A of Medicare. And so now any doctor visit and some of her doctor visits when she was in the hospital were not covered by that. But the fact that she didn't opt in for B, then to get B coverage today at 91 on her, we would have to go back and pay a huge fine for all the years that she didn't have it since she took it in when she was 62 years old.
So looking back on that, would you have recommended that she go with Part B? If you were in her shoes, would you have taken Part B?
Well, it depends on your philosophy in life. Medicare will pay certain doctor visits and certain doctor visits they won't. So you have to look at what kind of health care are you looking for. If you're looking at more of a preventative health care style, Medicare Part B is not going to pay a lot of those preventative doctor visits.
Sure.
And so it may not be worth it for you to have that come out of your Social Security check every month.
Okay.
So, but at the same time, if you are prone or you have a history of like high blood pressure or you've got something like diabetes, then it's probably in your best interest to think about taking Part A and Part B and Part D.
Yeah. And something to keep in mind with the Medishare Senior Assist program, you have to have Part A and Part B.
Yes.
Medicare Part A and Part B in order to get that. So that's kind of like catastrophic coverage. If you had an extended hospital stay that Medicare is not going to be covering, then that would provide you some protection there. You would have to have Part A and Part B to be able to participate in that. So that's something good to keep in mind. So the cons on Medishare. We looked at the pros. Now, what about the cons? There are fees for every hospital and doctor visit that you pay out of pocket before they will cover anything.
Well, that's like a deductible.
Higher fees, yep. And there is they have in-network doctors that they work well with. If you can use out-of-network, they will apply what's usual and customary to their fee schedule, and that might be the only part that they will share in.
And that's not a bad thing. It just means that you have to go in with the idea that you're going to have to negotiate with the doctor's office.
Sure.
Because if they're charging something above what is normal and customary, they really probably have their fees too high anyway.
Possibly. Yeah. And so with Medishare, they have not all routine visits and checkups are covered, kind of to be expected. You'll pay for a lot of that out of your pocket still yet. They don't operate in the state of Montana for some reason. So that's something good to keep in mind. And now I think we're one of the things, one of the last things on Medishare before we go on, they have a nice pricing calculator online. So I'll put that link right in here on the podcast resources. You can go there and see about what premiums would run for you and your family, or it's not premium, excuse me, it's a sharing amount, what that would run for you and your family on a monthly basis.
So we're not endorsing any of these products necessarily. It's just that we found that Medishare fit our needs more because we're not people that rush to the doctor for everything. So we don't mind paying that copay right up front because when we need to go to the doctor, we really know we need it, and we've been saving for that because we use our life insurance policies to save that money instead of just paying it out to some insurance company that we never see any benefit from. So some of the other ministries have some really good points too. Samaritan Ministries, we really considered that because with that program, you actually get to write checks to other individuals every month who are in need of the services.
Yeah,
and
so you're actually writing it to other people.
It gives people a feeling of more participation and more of a ministry and more of meeting other people's needs. And if that's important to you, then that's a really nice feature.
Right. Amy wrote in. She said, we use Samaritan Ministries because it seems more like a biblical approach to healthcare. We chose this one over another big one because that one was going to require that her husband get written doctor's permission to work out. They were going to have charge more for having high cholesterol. So that was the big thing for them. I think the other one, it was Florida-based. That was probably Medishare.
Okay.
So that's something good to keep in mind. With Samaritan, they have a broader range of expenses that they will share for, such as chiropractic and homeopathic visits. They have a lower sharing threshold, $300 to $1,500 per member. Reading through their contract, there seems to just be more fine print and conditions on what they will cover or up to how much. So be sure to read that fine print if you're looking at that. They have a $250,000 annual sharing limit. So
that could be maxed out pretty quickly.
It sure could be.
In a hospital.
It sure could be, yeah. And they have another program that you can add on to that to provide unlimited sharing. But that is going to be a little bit extra. Look into the details of that. It seems to build as you're with Samaritan for a longer period of time.
Yeah.
That's good to know.
So the other two sharing ministries is Christian Care Ministries and also Liberty Health Share. And with Liberty Health Share, John, isn't it? There's less of a mission statement that you have to sign on with, less of a
right. You have less lifestyle requirements. You have more just general beliefs that you subscribe to be a part of them. So that might be an option for some people. Again, with them, there were lots of terms and conditions. They do seem to have lower prices than some of the others. But you also have this $125,000 to $1 million cap per incident that happens or per diagnosis.
So that's something that you want to be aware of
Yes.
because that could really that could not protect you like you're hoping to if you've got assets that someone could take through a healthcare litigation.
That's right. Christian healthcare ministries, they also tend to have, looked like they had low prices. They also have that $125,000 sharing limit. They do have what's called the Brothers Keeper program. Some of you wrote in about, and that will extend it for up to $100,000 a year. So even though it's unlimited for a lifetime if you're on the gold plan and on that program, it depends on how you combine the different programs, the different membership levels that you're at with them.
I'm just thinking
there
again.
There is a limit there.
Our neighbor has a friend that had a stroke and went into the hospital. And he's been in the hospital now since early June. And he's never revived consciousness. And, because he doesn't have immediate family, there's people having to meet in committees and deciding whether they're going to put a trach tube in him or this or that. And recently he just had another incident and went back into ICU. But he hasn't left the hospital since the first part of the summer. His medical bills are going to be way over $125,000, way over $1 million. His medical bills are probably reaching $3, $4, $5 million because he's had so much intensive care. And of course, we need to be aware of these and what that could do to our family if something like that happened to us.
Yes.
And even though these share ministries aren't insurance, we want to make sure that we're protecting our family from an incident that could wipe out all of our resources and put a burden on our family if something should happen to us.
That's right. So obviously we have a lot of information on MediShare since that's the one that we ended up choosing to go with. I'm going to post on the podcast resource page some of what the rest of you wrote in about some of the different ministries that you're with. So that way you'll be able to look over that information. I'm also going to post links to the guidelines, the sharing guidelines for each of those ministries so you can do your research and see which option is going to be the best for you and your family.
So until next time, when we'll be back here talking with you about solutions, money, and other things that create wealth, you have a great week.